we'd really love to hear questions from you. The goal of this is really to inform you about this mechanism and about what the IARS can offer you as an international applicant and just participant. And one of the goals of our committee, the International Engagement Committee, is to just get more people involved. So we're going to have a number of speakers. I'm going to kick it off just giving a little bit of an introductory talk about the mechanism itself and some key components of a strong travel grant application. Also, just to put on your radar, the upcoming webinars. There's one coming up about vasoplegia and on November 18th, and then the future of transplant anesthesia, which is co-sponsored by the Society for the Advancement of Transplant Anesthesia on December 9th. I'll just start saying a little bit about me, and then we're gonna introduce everyone else, and maybe I'll go around and have people just say hello and say a little something about themselves. So I'm Kristin Schreiber. I'm a professor in the Department of Anesthesiology, Perioperative, and Pain Medicine now at Stanford, just moved a couple weeks ago. But I've been part of the International Anesthesia Research Society International Subcommittee, member and chair of the Outreach Travel Grant Review Study section. So we've had 1 year of these things, and I think it was really successful. Just a little bit about me. My clinical work focuses on acute pain and especially the acute to chronic pain transition as people have surgery. I employ regional anesthesia and multimodal analgesia in my daily practice. And then my research program really centers on understanding mechanisms underlying the transition from acute to chronic pain after surgery. I've been a member of IARS International Subcommittee for over 2 years. And as I said, I served as the chair of the study section. I'm really passionate about promoting, mentoring, and sponsoring excellent translational research that people in the entire world do, and like really bringing that to IARS, especially things that are related to taking care of patients. My disclosures are just that I'm an editor at a couple of journals, and I receive funding through the NIH, or at least, for now. We have a number of amazing people on this panel, and so maybe we'll just have them say hello. I don't know if everyone's planning to do their own introduction as part of their talk, but maybe since they're on here, we'll have them say hello, starting with Brad. And you have to unmute, yeah, if you can.
Thanks. Yeah, the Zoom wasn't letting me unmute. All right. Hi, my name is Brad Fritz. I am an assistant professor of anesthesiology over at Washington University in St. Louis. And I'll be speaking to you a little bit later in this session on what makes an application stand out from a reviewer's perspective. Really looking forward to chatting with you guys a little bit more.
All right. And then Alice, if she's on already and can unmute.
Hello, the videos cannot show because of the limited by the Zoom room.
Okay.
Hello, everyone. I'm Xinyan from Beijing Tiantan Hospital. I'm the new member of in this subcommittee, and I will have a short presentation later and give a brief introduction.
Yeah, we're so lucky to have two of our previous awardees here. I don't know if Gerald can unmute and say hello. Might have the similar restrictions.
I don't see him on yet.
Okay, so he'll likely be joining us later, but Gerald is also going to be talking about his experience and advice from being a 2025 travel grant recipient. And then at the end, we'll have a kind of a Q&A to answer your specific questions. If you would like to, as you think of questions that you want us to address, you can just go ahead and write them in the chat at any time. And then as we take breaks after each of our kind of sections, we can address them. And of course, you can just ask questions like in a real voice as well. Okay, so that's sort of the schedule for today. I'll kick it off by talking a little bit about the purpose of the IARS International Outreach Travel Grant. So these are some pictures from our last meeting, which was in Hawaii, amazingly, and some of our excellent awardees there. So the objective really is to support early and mid-career researchers from low, middle, and upper middle income countries so that they can present their anesthesiology or perioperative medicine related research at the next IARS meeting in 2026. Which is going to be in Montreal, Canada. So not Hawaii, but still a beautiful city, and like it's going to be an amazing meeting. The benefits, of course, are to have international exposure and financial support for your research, an opportunity to present in a really dynamic multinational context. This is a fabulous meeting. Make new connections with people, with potential collaborators, mentors, peers, and really learn from people around the world. So the key deadlines are that the travel grant submission itself is November 23rd. So coming up in a little over a month, I guess. December 7th is the abstract submission, but as I'll explain, you really need to submit your abstract for IARS before then so that we can kind of look at it together. And then in February 2026, we'll let people know. And, we'll try to do that as far in advance as we possibly can so that people have a chance to make their travel plans. So in essence, this International Outreach Travel Grant is a two-step process. So you submit an abstract to the annual meeting, and then you submit a travel grant application separately. I showed the deadlines for those, and we'll show them again. But basically, you have to have your abstract accepted in order to really be eligible for a travel grant. So starting with the first part, which is the abstract submission itself. Many of you likely have submitted abstracts for scientific meetings before, but here are some general tips. A nice, catchy, clear title that sort of gives the essence of what you're talking about, is descriptive, is always great. Focusing on a predominant main message. You may have multiple components to what you're doing, but try to boil it down to a single clear takeaway. Concise, obviously it's an abstract, so it's always that in many ways that's the most difficult thing to write, is something short, right? So going over it and shortening it down, you take out those filler sentences, and really the focus should be on the results and why they're important, and emphasizing the impact and relevance. Why does it matter to us? Why does it matter to you? Why does it matter to anesthesiology, critical care, or perioperative medicine? Innovation is part of it, and practical applications are part of it, but really sort of the impact. So that's your abstract. And there are different sections, so just, ensuring a flow so that people can really understand your work just from that abstract. Often we want to see some kind of numbers. Now, depending on the research, you may not have a lot of numbers or statistical tests or p-values, but it's nice to know that there's some kind of quantification or some sort of analysis that's gone on. And so use numbers effectively. Obviously, double checking formatting and guidelines. A good idea is to ask a colleague, or maybe two, who's somewhat unfamiliar with your research, to actually read it. You can pick up on the fact that you haven't said your main point. If they're like, wait, why are you doing this? A lot of times that can be very helpful. And obviously just general proofreading. It may help to, use some sort of tool for if English is not your first language, or have an, English speaking friend, like just go over it to make sure it's clear. Now, the other part is the travel grant application, and there, I'll just go through what the requirements. This just shows the grant amount. So it's a tiered award in the sense that people who need more money are going to be awarded more money because it's expensive to travel to Montreal. And it includes complimentary meeting registration. Some disqualifications are if you've gotten it in the past. Obviously, we don't really want people to submit more than one grant application. Pick your strongest abstract if you have multiple that you're submitting. And if you applied and received the Global Scholars Award in the same calendar year. So other requirements are that you belong to the IARS, that's easy, located in a low, lower middle, and upper middle income country. You submitted an abstract. I mentioned that, so that was the last section. We're looking for people who are early career or mid-career investigator, or even people who are currently in training, pursuing some sort of career that involves research. It can be anywhere from very pragmatic research to basic science research, but we're looking for people that are interested in making research part of their career. And then that the research itself is related to anesthesiology or perioperative medicine. It can be connected directly or collaboratively to an anesthesia department. So while many of our folks who apply are in anesthesia themselves, they don't have to be, just as long as the research is connected to an anesthesia department. Some tips for making your travel grant very strong, and this is as someone who read a whole bunch of them and sort of looked at the awards of them last year. I would say, as I mentioned, submit only one application. I don't know that it was so common to get multiple applications, and kudos to you if you have more than one thing to submit, but just choose your strongest abstract and kind of highest likelihood. Ensure that all the required information is on there, just kind of read the instructions about what kind of information we want and the required attachments. As with the abstract, you want to clearly demonstrate how your research is connected to anesthesiology or perioperative medicine, and then explain how coming to the meeting itself will impact your career. So this is sort of a separate piece from the significance of your work. Why is it that coming to the IARS is going to be helpful to you? And there are some things that are true of everyone, just collaborating with people, but perhaps give us a little personal information about how it particularly would affect you. There is a one-page letter of motivation that is part of the application that's required. And what we're looking for here is just to descriptively and clearly outline your goal for your research and your career, how attending the IRS meeting will benefit your research and career, and what you hope to achieve after receiving the grant. So give us a little, peek into what you would like your future to look like, what resources and support you are requiring to achieve those goals, and how the travel grant sort of fits into that. And as I mentioned, kind of like, where do you see yourself going? Where do you see yourself in 5 to 10 years? That's a lot to put in one page, but, again, encouraging you to go ahead and iteratively improve this page and have others read it. What we're looking for, when we actually read through all these, we have some review criteria, and we rate each of the applications that we get along these criteria, and actually have a pretty not sophisticated, but an elaborate system to actually look at all the scores side by side. So the first thing is scientific significance of the research question. Is it addressing an important challenge or a gap in anesthesiology or perioperative medicine? Is it novel and original? That's sort of the innovation piece is what you're doing, like having some innovation. The environment that you find yourself in, like obviously we know that people need support, but sort of understanding, do you have a mentor? Do you have institutional support? And what's the regional context? Like, we want to make sure that people are going to be able to do the research and have the career that they would like. We want to know about the candidate themselves. This is an important aspect, how productive you've been in the past, based on the resources that have been available to you. And then the impact that the grant and the travel to IARS meeting will have on your career development and research outcomes. So in conclusion, we really hope that you will go ahead and apply. Again, these are the 2 deadlines. So the first step in a way is to submit your strongest abstract, even though that's due later. And then complete the travel grant application. So you can, it's definitely on the website, but you can also scan here, emphasize the impact, clearly highlighting how this will support your research and career. So that's a lot of me talking. So maybe we can take a break and see if there are questions in the chat. Before heading on to the next section. I'm going to look in the chat. So the first question, and I may turf some of these to Megan as well. How do you become a member of IARS from low-income countries? I don't think that it's like a specific category within IARS, just becoming a member of IARS. Megan, do you have any thoughts? It looks like you put a link there.
Yeah, we do have a membership option for anyone who's located in a LMIC or UMIC. It's a lower rate. I put the link for where to sign up for membership. If you are in training, membership is free. So there's a join button there and you can sign up that way. Just fill out a form.
Yeah, I think maybe that's the concern, is like the membership, is the membership complimentary? Because that could potentially be a financial burden. If anyone would like to unmute and ask a question about, and obviously you can keep putting questions into the chat as well.
It looks like there were 2 other questions. One was,
Okay.
Are medical students eligible for the travel grant? And then
Yes. So I think that we did have a couple of applicants last year, if I remember, and definitely reviewed them along with other people. So you can be anywhere in your training.
And then the other question was, if their application for the Global Scholars Grant gets rejected, are they eligible for the travel grant in the same year? And the answer to that is yes. You just can't receive both of them in the same year.
Okay. Other questions? I know it's sort of, Zoom is a format that we all know and love, but it's not like being in person. Okay, so for the travel grant, should the abstract be on a completed research or can it be proposed research? I mean, yeah, so any abstract, this is what I was saying about like having some numbers with it, usually we want to see that at least there's some preliminary results. Just the IARS, when they look at people's abstracts and, what they're going to actually accept as an abstract for the meeting, typically it does not, it's not like a research plan. That's not what they're looking for. And so, even though oftentimes you submit an abstract on research that has just started, maybe you have some preliminary results, and it's great if you have all your results and you've not yet published it. That's sort of the ideal. But I would say kind of like just a proposal for research is not what we're looking for the abstract. We can, yeah, so another question, should the research be prospective or can it also be retrospective? Absolutely, it can be retrospective. Yeah, so really all kinds of, based like all the way from sort of epidemiological research, retrospective cohort studies, prospective cohort studies, RCTs. I think we even had, if I remember correctly, like a qualitative study that had like a quantitative component, implementation of programs, like clinical innovations that you have a little bit of sort of numbers on, you've collected some data. All of those are fair game. Another question, are only primary studies eligible for the travel grants, or are systematic reviews with meta-analyses also eligible? I would say generally, the thing about the meta-analyses is, again, it's often not going to be accepted by IARS. I don't think that they tend to. I mean, I don't know, maybe others could speak to that. I that's my impression, that they don't tend to accept meta-analyses as an abstract itself. Can we submit abstracts that have been submitted to other conferences? Again, I'm not sure exactly what the IRS's official policy is on that. Some societies do accept that. I think often they're looking for something that's, original. It's the first time that it's being actually submitted as an abstract. So while maybe part of it has been presented in another meeting, if you have something that's original, there can be a little bit of overlap. That's what I would say. But if anyone else has insight on that, I'm happy to hear. All right, well, thanks for the questions. And I think maybe we will go ahead and transition over to Brad and his presentation. Brad, if you want to start pulling that up.
Perfect.
One last question, so we cannot submit the ones already published in a journal. I would say, yes, that's true. It needs to be original research. Thanks.
All right. So hello, everybody. My name is Brad Fritz. I am an assistant professor at Washington University in St. Louis, and I'll be speaking just for a little bit on what makes an application stand out from a reviewer's perspective. So I have no financial relationships, no disclosures. Clinically, my background is that I am an intensivist. So I work in the intensive care unit, and my research program focuses primarily on the use of predictive analytics and innovative care pathways, such as telemedicine, to improve care following surgery and critical illness. So I'm going to step through the scoring criteria that Dr. Schreiber just shared with you and think through in a little bit more detail what each of these means, how you can make your application stand out in each of these areas, and also how they correspond with the actual documents that you submit. So as a brief review, the 5 scoring criteria are the scientific significance of the research question, the innovation of the project, the environment for the project or the question that you're pursuing, the candidate background and accomplishments, and the meeting. So that first criterion, the scientific significance, really the core things that I am thinking about when I'm looking at an application is, well, what problem is it that you are addressing in your research? Why is the problem important? So some things that might make a problem important is if it's something that's really common, or maybe if it's uncommon, does it have really important consequences? Like bad things can happen to people that are experiencing this problem. And also related to significance, I want to have some idea what is known about the problem and what is unknown regarding the problem. What is the gap of knowledge that's in the field? And how does filling that knowledge gap improve things for people? So in essence, this scientific significance criterion is really getting at why is this important? Why should someone who is reading your research care about the work that you're doing? And so you really want to make sure that you convey that clearly in your abstract that you are putting together. The second criterion is innovation. And this is referring to the innovation of the project or the question. And so really the thing that I am asking myself when thinking about innovation is, well, are you doing something that no one else has done before? And there's lots of ways, there's lots of different ways that a work can be innovative. It could mean that you are using a new technique that no one else has used before. It could mean that you are maybe using some existing techniques, but applying them in a new way, in a new context, in a new setting. Maybe those methods have never been used to ask this question. Or maybe you have some unique patient population in your institution or in your area, or a unique resource. Maybe there's a unique data set that you have access to. There's a unique other unique resources and how you've leveraged those in ways that maybe no one else could do that. And so you've done something that really no one else might be able to do. And that is sort of what the innovation criterion gets at. The third criterion is the environment. So the environment for the project, the question, and this is looking at the institutional context, the resources to support the project. And so some of the things that when I'm reviewing for this particular application that I'm thinking about regarding the environment, there's actually two separate pieces. So one is, are there ways that your institution has demonstrated commitment to your career development? And because part of this is about you as a candidate and you as sort of what your career trajectory looks like. So has your institution maybe given you access to training opportunities to sort of advance your career in research? If they have provided funding for projects in the past, that's sort of a really big sign of commitment. Obviously, not everyone has access to that kind of a resource. If your institution has given you time to pursue your academic interests, your research interests, that is another way that sort of is demonstrating that your environment is really conducive to commitment to your career. The other thing that I think about when thinking about this environment criterion is, what are some of the challenges that you had to overcome in order to accomplish the work that you have in your abstract? So there are lots of things that can be challenging. There could be staffing challenges that you've had to overcome. There could be technology limitations that you've been able to find ways to work around and do something that is really novel, really interesting, really important, maybe in a setting where you have fewer resources. And that is something that is really important and really worth conveying of what are the challenges that you've overcome to accomplish the research work. So the fourth criterion is candidate. So here we are looking at your background, your accomplishments, taking into account the resources that are available to you. And this is not so much in the abstract itself, but more in those additional documents that you're submitting as part of your application. So the things that I really want to see in thinking about the candidate is, have you explained what your career goals are? And this is in that letter of motivation. Again, we're looking for people who are motivated to have a career that is involving research in a significant component. But we want to know that you have sort of an idea of where you're trying to go with your career. And then I want to know, do your past experiences seem to support your career goal? Sometimes that means that the abstract, the work that you're doing, is building upon work that you've done before, and you sort of have momentum moving in a particular direction. Or maybe it is building on your clinical work. Maybe you have a lot of clinical expertise in a particular area, be that maybe obstetric anesthesia or pain medicine, whatever the area is. And as sort of is your research work is building and snowballing off of that. Sometimes your current abstract, your current work is a shift from work that you've done before. It's something in a new direction. And if that's the case, that's great. Tell us why. What did you learn from your previous work that has moved you in a new direction, and where do you see yourself going in the future? Really, we want to see a story about where you're going now and where you think you're going in the future. And then our fifth criterion is the impact of the award and the impact of travel on the IARS meeting on your career development and the outcome of your research. So really for this criterion, it's easy to sort of be very, very vague. So really what I like to see is that you have some concrete examples of what you're hoping to get out of your experience of coming to the IARS meeting. Some things that people have talked about in the past that seem to be really compelling and reasons why people want to go to research meetings, networking and meeting other people, which that helps with developing new professional collaborations, maybe new research collaborations, people that you might work with in the future. Exchange of scientific ideas. So when you present your work, you get feedback from others who are experts in the field, and that strengthens your work and tells you what questions to ask in the future. And also, are there new skills that you're going to gain by attending the meeting or new knowledge that you're going to obtain? So really explaining some of those things. And then how do these criteria relate to the anatomy of your application? So your application, really, there's three main components that I think about. I don't want to say that these are the only three things that you'll submit, but the main pieces are your abstract itself, your letter of motivation, and your CV. On the left side, you see in the abstract, your significance, you're mostly going to be talking about probably in your introduction. Maybe it's kind of come back in the conclusions where you talk about the impact of your work that you've done. Your innovations probably also going to be described in the abstract as well. Most likely in the introduction, it could be in the methods that you're saying, well, this method has never been done before. The letter of motivation, I'm going to be looking to see, for the candidate description. Well, the candidate really is split between the letter and the CV. The letter is where you're going to really talk about your career goals and your motivations and where you see yourself going. And the CV is going to show some of your background, your past accomplishments, and how they support your career goals. The environment is, again, going to partly be something that you might describe in your letter of motivation, but also in your CV. If there's been past support that your institution has given you, you'll see those two pieces play together. And then the impact, describing the impact of the award and what it will have on your career, really you're looking to have that in your letter of motivation. So these are really key things to include in that letter that you're writing as you put it together. And then overall thoughts, as you saw, all the criteria apply across all the different pieces of the application. So all of them are important. And within the abstract, just a general tip that I would, in addition to all the tips that you heard from Dr. Schreiber, another thought is that in general, the different sections, the intro, methods, results, and conclusions should probably be sort of well balanced. If I see an abstract that has like a really, really long introduction and then barely any methods results, that's an indicator, well, maybe it's a little bit unbalanced and there might be an opportunity in a stronger application might have a little bit more balance between those different sections. Again, proofreading, make sure that your communication is clear as possible and making sure that you follow the instructions. And thank you so much for your attention. I saw a few things pop up in the chat. Let me stop sharing and let's see if there's any. It looks like, okay, so Megan provided some information about access to the video, which will be available after the meeting. So we'll give just a second for questions and then we can maybe transition to the next speaker. And I don't know if you have slides to pull up or if you're just going to be speaking. Yeah.
I saw there's two questions that are a little further back, but I don't know if you all have answered yet. There was one that asked, should the research be prospective or can it also be retrospective?
So retrospective research is absolutely acceptable. So either form is, as long as it's something that is important and exciting, we would love to see both of those things.
And then the other question was, are only primary studies eligible for the travel grants or are systematic reviews with meta-analysis also eligible?
Yeah, so in general, I would think that a primary study is going to be a stronger abstract. I'm not sure if IARS has a general policy on whether systematic reviews, meta-analyses are accepted. I know Dr. Schreiber thought maybe not. I actually wasn't so sure that they would not be accepted. Certainly, I would say that a primary study is a stronger application.
And I think those were the only questions.
Okay, perfect.
And then Dr. Wang, I'll pull up your slides, and if you just want to tell me when to advance them for you. Can you all see the slides? Yeah, okay, good. Dr. Wang, do you want to come off mute and you can walk us through?
Oh, okay. Hello, everyone, and good afternoon and good morning. And my name is Xinyan. I'm from the Department of Anesthesiology at Beijing Tiantan Hospital, the Capital Medical University. It's a great honor to be here, share you my experience for applying the international travel grant in this year. And I would like to extend my heartfelt gratitude to the International Anesthesia Research Society for awarding me the International Audition Travel Grant, an honor that is incredibly meaningful to me. I also want to thank the organizers for giving me this wonderful opportunity to share some of my experience in applying for this award. Next slide, thanks. The next slide. Okay. And before begin, please allow me to make my disclosures. I have no financial relationships with commercial interest to disclose, and the content of my talk, my presentation, will include discussion of some investigational use specifically regarding a randomized controlled trial that compared the effect of 3 common vasopressors on cerebral hemodynamics during CEA surgery. Goal of this investigation was to identify the optimal agent for this specific clinical scenario. Next slide, please. Thank you. Receiving the award is more than just financial support. It is a significant milestone in my career. As the reviewers themselves note in their feedback, the award would contribute to my career, and attending the IARS meeting holds significant potential for my future development. This opportunity has opened a gateway to the international stage, allowing me to gain some new perspectives to improve my research and building connections for future collaborations and engage with a global community of experts and mentors. And next slide, please. Next slide. Thank you. Okay. And so, how can one prepare a competitive application? I believe the key lies in understanding what the rewards focus on. By analyzing your feedbacks, I found that the evaluation is structured around 4 key pillars. The first one is the scientific significance of the research. Is the research question compelling and clinically relevant? And the second is the candidate themselves. Does the applicant show promise, productivity, or a clear vision? And the third is the potential impact. How will this world meeting concretely benefit the application's career? And finally, is the overall context, including financial need and geographical representation. Next slide, please. Thanks. Next slide. Okay. The pillar 1 is let's begin with the first pillar, the research proposals. The reviewers appreciate that the project has a potential to directly impact clinical practice, but they also offered a very fair comments that my outcome was physiological rather than clinical. To address this, my approach was to was 3 ways. The first, I started with a real clinical problem to highlight a gap in current practice. The second, I leveraged our lab's unique strengths in transcranial Doppler to investigate its underlying physiology. And most importantly, I framed the project as a fundamental, and this is an experimentally randomized controlled trial, and this explanatory acknowledgement that the physiological focused work well position is a critical first step towards a larger future clinical outcome study. And the second pillar is in the next slide. Next slide, thank you. And the second pillar is the candidate. The reviewers pay close attention to your background and accomplishment, even noting details like how many articles you published and how many articles you are the first author or co-first author. So my approach is to first to show, not just tell, by designing my CV to immediately highlight my productivity, especially my first author publication. Second, I clarified my academic trajectory. Assistant path from my bachelor's degree to my PhD degree to demonstrate a long-term commitment to the field. And third, in my personal statement, I connect my past achievement with my future vision, showing that my research is driven by a passion to solve real-world clinical problems. Next slide, please. Next slide. Oh, the third pillar is about articulating the impact of the word. The reviewers look for a composed and certain response. My strategy was to be specific. Instead of vaguely saying it would be good for my career, I broke it down into concrete benefits, broadening my horizons by learning from others, improving my research quality, by getting expert feedback, and increasing international collaborations by building relationships. At the same time, align my personal goals with the mission of the IARS, framing the opportunity as a chance to found lifelong mentorship connections and established future collaborations, which show that I deeply understood the value of the word. Next slide, please. Thanks. Finally, let's discuss the overall context. Regarding financial needs, the key is to be transparent and professional. I provided a clear, itemized cost breakdown and compared it to my residency salary, effectively demonstrating a genuine need for the word. The reviewers know this, stating that my stipend was constrained and external support would be required. As for geographical location, well, you can't change it. You can be aware of its potential impact. The reviewers said that I was the first application from China in their next many years applications, and this line with the foundation score of broaden representation. So don't be discouraged if you are from a less represented country or region. It can sometimes be an advantage. Next slide, please. In conclusion, my journal to screen this grant was fundamental about transforming a clinical question into compiling research story. It's not just about what you have done, but about what you plan to do and how this work will be catalyst to help you achieve it. I want to encourage everyone here to believe in the value of your clinical observations and to take the brave step of applying. As international scholars, your perspective are both vulnerable and welcome. I sincerely hope my sharing has been very helpful, and I wish all of you have the best luck of your future applications. The international stage is waiting for you. Thanks. That is all presentation. Thanks for listening. And the next slide is about my personal email or some information about myself. If you need help, you can send email to me. Is that all?
Yeah, thank you so much, Alice. That was really great. A wonderful candidate and awardee. So there, everyone has it. This is what you need to do for success. Hopefully, some of the themes, resonated through mine, and then Brad's, and then Alice's presentation. I think we have Gerald possibly online. I'm not sure if he was able to make it yet or not.
I don't think he has, but
Okay.
we will add his presentation to the video post meeting. So
Yeah,
if you all check out the video. Yeah.
Another amazing awardee. Do people have questions, maybe prompted by Alice's excellent presentation? She might be able to answer them, but we can also try to do so as well.
Oh, sorry, there is some delay for the information at the chart. I can't see the new questions.
Yeah, I don't see any new questions
Oh.
either, but yeah. But you're right, there may be a delay also. The internet's fast, but it's not. There can still be delays.
Hi, can I ask a question?
Yes, please. Hi, Umanga.
Yeah, hello everyone. It's such a pleasure being a part of this event. I'm actually a medical student. I'm from Nepal, and I'm a couple of years away from my graduation. And I'm really interested in anesthesia and been recently getting involved in some research. So my question is, do I need to be the first author or the primary investigator to have my have my application accepted, or can I submit it as a co-author or a co-investigator?
Well, that's a great question, and congratulations on heading into an excellent specialty. So I would say everyone who applied last year, they were the first or last author on their abstract. If there is, so if possible for you to become like a co-first author, if there's, other folks who sort of like are holding that spot, or, sometimes authorship can be tricky, but I would say, it's like something that you yourself are taking a pretty primary role in. That would be great. I don't know, Brad, do you have any other thoughts on that?
No, I agree that really for you to have a really high experience sharing work with others, it needs to be work that you were really integrally involved with, which generally means you'll probably be a first author, co-first author for that type of abstract.
Thanks for the question, though. Do others have any questions? Even if you don't ask them today, feel free to reach out to us. Maybe I'll go ahead and put my email in the chat, because if you think of something later, you can also reach out to, I'm going to put Megan. Megan, I'm going to put you out there.
Of course. Yeah.
As someone that you can ask questions to. And also Brad put his in there as well. Yeah, and I think Alice provided hers as well, if you don't want to ask either of us. I think, just to give people a sense of how it went last year, I mentioned this already, I've been involved in a number of different kind of training grants, study sections and things like that. And think, we had a fair number of applicants, and, we have a committee. And so everyone on the committee reviews like a pretty large number of them, right? And we have some overlapping, and then we have a system for scoring them that kind of takes into account like, oh, do people, different people on the committee score things sort of differently to sort of make sure that everybody really gets a fair shake on that score. And then we have, like we discuss them in a meeting like you would for a grant, any kind of grant. And that's sort of our process. So, just keep in mind, you'll have several people on the committee reading it like much more carefully and scoring it, and then kind of presenting it to other people on the committee. Oh, okay. This is a great question.
Yeah.
Yeah. Do you want to
how can we
talk
avoid
about that?
sounding, yeah, so the question is, how can we avoid sounding too generic in a motivation letter? Or in other words, what are some red flags you usually notice when reviewing the letter? So, I think that a core aspect is that there are topics that you want to make sure that you talk about, like your career goal, the impact of travel that will have on you. But the career goal, for example, needs to incorporate something that is sort of personal to you, because all of us, even if we have sort of similar careers, like in that we're doing clinical work and we're doing research in anesthesia related areas, the nature of the research is going to be different. Like the type of research, if it's clinical basic science, is always going to be different. And actually articulating some of the details about, well, what is it that excites you? Where are you going with your career? Is it, for me personally, I'm a data scientist. And so my research career goals are probably, because I incorporate data science and I incorporate those types of things, are going to sound different than Kristin's. So I think that really having some amount of detail and something that's personal in those aspects is going to be something that makes it not generic, but actually be authentic and personal to you.
Yeah, and it may, I mean, don't worry about making it like I have to come up with something totally original. I feel like I've read a lot of kind of residency application or fellowship application letters where people are like, here's my personal statement. It's got to be like this amazing thing that I like cured cancer or whatever, but like, no, just saying where you are in your life, like things that have happened to you that have kind of led you to the point of wanting to do research. I think that's great. And that always comes across as, I mean, to me anyhow, that sounds, that kind of cuts through the generic. It's like, yes, we all have had similar experiences. So by definition, we're going to have some overlap, and that's fine. Doesn't have to be like 100% original, but just as long as it's you. So, okay, another question. Working on a retrospective study, not in the analysis stage. Yeah, right. I know that's tricky because you're like, I'm not quite there. Yeah, if you can, in the next next month or so, if you can really try to push forward and get something analyzed, like a preliminary analysis, I think, and get a sense of what your results are going to show. Oftentimes that, I hesitate to recommend that, but I think we all do that. We're like, okay. And sometimes that's the little boost that you need to like push you forward to like get a certain aspect of your work done. So I would say yes.
Yeah. And I'll piggyback too that also, if you're doing something prospective, reporting what you have accomplished thus far, even if you're continuing to enroll more patients, for example, can also be effective too. So both for prospective and retrospective, I think that principle applies.
Yeah. And a lot of times, when you are presenting your prospective work or your interim results, you'll get great ideas from people that may impact, how ultimately you're going to frame that. And that's one of the benefits of showing an abstract and coming to a meeting with people who will have a different perspective on your work. Okay, I saw Alice put her email in there as well. Okay. Well, let's see. Okay, we have another question. Does that mean that we can analyze with what we have, although more cases to be included yet? Yes, the answer to that is yes. Present it like a preliminary report. That's fine. I mean, obviously it's like maybe not going to be as strong as if it were completely finished, but I don't think, I mean, as long as you've got enough that you can actually do something with it. All right. Well, so I think we're right at the hour, whatever hour it is for you. Thank you so much, everyone, for joining from many different time zones and for engaging with us. Thank you. Oh my gosh, I think I just saw a picture. Oh, there she is. Yay. Now you can see an actual awardee. Alice is we finally have her video. Thank you so much. Thanks, Brad. And thank you so much, Megan, also for all your amazing organization. Megan's a wonderful resource, so please do reach out to her or to us if you have questions, and we will look forward to seeing your applications. Oh, happy World Anesthesia Day. Wow. Thank you for calling that to my attention anyhow.
We didn't plan that.
That's 179th. Wow, that's amazing. Thank you. All right, guys, on that note, have a wonderful day, evening, night. We'll see you hopefully in Montreal.
Thank you. Bye.
Bye.